Thank you for listening to Here's to Your Health, a podcast brought to you by the Crawford County Memorial Hospital. During this podcast, we talk about healthcare, the people behind it, and the opportunities that help shape the next generation of medical professionals. This podcast is where we share stories, insights, and conversations focused on healthcare and the people who make a difference in our community. Thanks for listening to the Here's to Your Health podcast.
Welcome to Here's to Your Health, a podcast from Crawford County Memorial Hospital. I'm Dustin Durbin, Volunteer Services and Community Outreach Coordinator at CCMH. June is Men's Health Month, and today we're talking about something many men tend to put off: routine health and preventative checkups. Joining me today is Michael DeLong, licensed practical nurse at CCMH. Michael currently works on our medical unit and has previously worked in the CCMH medical clinic. So he's seen firsthand how important prevention care can be. Michael, thank you for joining us today.
Thanks, Dustin.
Let's start with something pretty common. Why do you think so many men avoid going to the doctor unless something feels seriously wrong?
You know what? That's a great question. In nursing school, there's this story that we like to tell. So if there's a farmer coming into the ER and saying that he didn't finish chores and that he drove himself in and he's having chest pain, you better worry. Most men don't go to the doctor, whether it just be fear of not wanting to know or just thinking everything is fine. And there's that saying, pride and partially not knowing is bliss, I guess.
Well, perfect. I think a lot of people picture a checkup as something complicated or time-consuming, but really, what does a typical annual wellness visit look like?
Sure. During a typical annual wellness, we will obtain your height, your weight, your vital signs, and then we'll go over all your medicines that you are prescribed or that you take over the counter. We can also go over any recent surgeries that you might have had or anything else that may have occurred since your last appointment. A lot of people will sometimes go to another facility to possibly have a procedure, and they assume that we get that information, but it's not always true. The physician will also do then a head-to-toe assessment, and then we can discuss routine screenings.
That kind of leads me into the next question here. What are some of the most common health concerns you see affecting men as they get older?
Some of the most common health concerns that we are seeing are colon cancer, prostate cancer, heart disease, diabetes, and also, since we're in the Midwest and farmers, skin cancer.
You know, you mentioned some of that. And then, are there certain screenings or prevention tests that men should really stay on top of?
Most men, although they don't want to do these things, we recommend doing a colonoscopy, PSA, it's a blood test for your prostate, an EKG and lab test. We can also do your blood pressure, and then we do routine skin checks.
You know, you mentioned colonoscopies, and those actually have a lot of misconceptions and things of that nature. What's something that you would tell guys that are really feeling like uncomfortable or worried about going in for a colon screening?
Sure, yeah, I hear it all the time. The easiest way to prevent colon cancer is to start colonoscopies between the age 45 and 50, depending on your family history. If we can find a small polyp early, it can be sent off and tested and determine the appropriate treatment options. Cologuard is also a way that can help you not necessarily be an invasive procedure, but it will help check for precautions, and patients can get a Cologuard. If it is positive, it would be strongly recommended to get a colonoscopy. Basically, prevention is the key here. If we can catch it early before it gets to be too big, that's the best thing for us.
No, I would agree with that. The better we know as men, the better off we are. But for someone listening who maybe hasn't seen a provider in a few years, what would you say to encourage them to schedule that appointment?
You know, ignorance isn't always bliss. So I thought about this earlier. Women will have a annual pap smear, and then they will have their mammograms every year. They go to the doctor regularly. Once you're 18 and you get a sports physical, men typically don't go to the doctor until their wife makes them go. So just getting to the doctor, and the most important thing that you can do for yourself and family is schedule a routine visit, which is typically a part of your insurance package. You can discuss screenings and your family histories, and let us help you feel confident in yourself for future.
Well, before I get into that next question, you're talking about men, we put these things off. Women, of course, they're always getting their screenings. They're really good about being diligent on getting things checked. But for men, what is something that we could do that we overcome? For me, for example, I don't have time. I'm running a bus service. I've got volunteers I've got to wrangle and get places. I've got other activities outside of work I've got to keep up on. What's something you would say to someone like me that's just our excuses? I'm just too busy.
Right. For just all general health, easy things that you can do for your general health: exercising 15 minutes a day. Don't get wrapped up in some of these gimmicks, some of these stereotypes. Don't feel that if I don't know, it hasn't happened. So if you can eat healthy, cut down on your calories, exercise routinely, go get your blood pressure checked, just have some easy lab work done. Just some of those things will just help you feel better about yourself as well. We have the YMCA here now in town, and that's a great place to just walk around the track, just get some physical activity, and you get to meet new people there as well. I've met a lot of new people since I've started there.
And that's awesome. I'm glad that we do have the YMCA here in town to really help us kind of, work on getting into better shape. Is there any other realistic things that we as men can do to improve our health without completely changing it overnight? I know you've mentioned, 15 minutes of exercise is great. What's something that we could do that's, if we aren't able to make it to the YMCA, we got to go back to thinking, Dustin's busy.
Right, sure. Take a walk. There's got to be a 15-minute lunch break that you can go take a walk. Don't make excuses. You can do it. Everybody can do it. Just get a friend to go out there with you. A buddy can always help encourage you, and you can do more for yourself when you have someone there with you.
I would totally agree with that. Well, Michael, thanks again for joining us today. For our listeners, if you'd like to schedule an appointment with CCMH primary care provider, call the CCMH Medical Clinic at 712-265-2700 or visit www.ccmhia.com to learn more. Thank you for listening to Here's to Your Health.
Thank you for listening to Here's to Your Health, a podcast brought to you by Crawford County Memorial Hospital. We hope today's episode provided helpful information and a better understanding of the care and services available in our community. Be sure to join us next time for another conversation on Here's to Your Health.